Good afternoon. I'm Nimisha from PhD Health Services, leading business operations. Coming back from podcast one, where we spoke about the essence of home healthcare, bridging the gap between the hospital and home healthcare. While various chronic illness needs special attention in home healthcare, cancer is one of the illness that needs support at hospital and at home too. Today, we are here along with Dr. Abhay Bhave to share some insights. Dr. Bhave has 2 decades of experience in hemato-onco and is a renowned icon in the healthcare world. He will help us with some answers that most of you would like to know. Hello, Dr. Abhay Bhave. Thank you for giving us the opportunity to share this platform with you. There are few questions that were shared by few of our audience from our previous podcast of we knew you will be the best leader to help us and have the right answers from them. To start with, let me open the forum with the most important question. Why would people prefer to take treatment at home?
Thank you, Nimisha. First of all, it's an excellent opportunity to view thoughts, and I'm very grateful to your PhD for this discussion. And your question is that why would people want to or prefer to take treatment at home? There won't be one specific answer. There'll be many answers, and there'll be situations where patients are terminally ill and do not want to stay in hospital, so they want home treatment. There are people who have completed the major treatment in the hospital and now have to take supportive care at home. So they are also candidates. There are some people who cannot afford hospital but can afford enough treatment to take at home so that they can fight the illness. So to my mind, I see three kinds of people who would want to take this home care. And I'm very happy that the concept of home healthcare has come in. And we learned this, I think, from COVID, isn't it? I mean, in COVID, we didn't have beds and people were treated from home. And that's the best example of home healthcare. And can we extend this to cancer illnesses? And my answer is yes. And so far, we've been doing it, but not as a concerted effort to do this from home, but out of sheer need to do it from home because we had no other choice.
So, Doctor, to more eagerness to take this ahead, I would like to ask you what would be the pros and cons of the treatment at home?
Yeah, I think that's a good question. So, pros and cons. Let's start with the pros. The pros are that costs come down. You're in your own environment at home. You've got home food. You've got your loved ones next to you. Your whole ambience and environment is something which is very friendly. And if you can treat treatment at home, which does not cause side effects, why not? I think that's a great idea. Cons. Suppose the insurance company does not support you. It says that no, these medicines cannot be given from home. Then who foots the bills of the medicines? Number one. Number two, what if you give a drug which has a reaction? Can you handle that at home? Do you need constant monitoring? Then do you need a nurse? Do you need a doctor? Can this be something which is self-administered? So those are some of the aspects that we'll have to see. So whoever does healthcare will look at what is the feasibility of that patient's healthcare in the house. So that patient's illness needing that particular drug, can it be delivered at home safely without compromising the health of the patient? That is the pros and cons that the individual doctor who's going to give the therapy will have to weigh before saying yes, you're a candidate for home therapy, because you cannot compromise anything happening to the patient by delivering a drug at home if you're not able to handle the side effects at home.
Sir, thank you for your insights on the pros and cons. Moving forward, I just wanted to know can you give home therapy for hemato-oncology disease?
Yeah, certainly. We can give quite a few drugs which are involved in the management of hemato-oncology disease, and I'll divide into two kinds of categories. One which is like a chemotherapy or actual treatment for cancer, and the second one is supportive therapy. And supportive therapy easily can be given from home, and that's very important in management of hematology oncology diseases. I'll give you some examples like growth factors, romiplastim, then there is filgrastim, there is erythropoietin. There is a drug in oncology which we use for leukemias and for myelodysplastic syndrome, which is called azacitidine. That's also subcutaneous. soon we'll be getting more drugs subcutaneous. So we can give them from home as a supportive care and also for actual treatment of a hematological disease. So there are many instances. It's just that the person giving it should be familiar with the drug and should know what are the effects and side effects, should know how to administer, what is the right dose. They should have a proper prescription from a oncologist or a medical oncologist who's prescribing the medicine, so that they can know that the right drug is being given to the right patient, the right dose in the right manner. So if that's all done, yes, certainly we can manage patients from home.
Thanks, doctor. Moving ahead, cancer being a chronic illness and one of the stressful situation in community families' life, do you really think seeking home health care support after a certain stage helps in the recovery support socially and mentally?
Yeah, that's a very important question. And I think if you see three C's of medicine, it's a cure, care, and comfort. So we try to cure patients. We can do that from hospital, and then the supportive care can be done from home. So care, we can give from home, and comfort we must give at home. So I think out of the three C's, we can actually do all three from home, but mainly the second two C's, that is care and comfort, can be done from home, because here is a person who's then in his or her own environment, friendly, home food, own bed, loved ones close by. So I think it makes a lot of difference for such people, that especially terminally ill patients can be taken care from home, or other patients who are post transplant who need supportive care also should be taken care from home. Those who've had major chemotherapy and have gone home should take supportive care from home. So I think home care is an extension of hospital care in most of the cases. Patients who need home care should be done from home, so that they don't have to come to hospital and occupy the bed of someone else who's needy. So if you provide good home care, I'm able to take more patients into the hospital and give those patients treatment which they deserve in the hospital surrounding, and then restrict those who need home care to therapies which can be given from home. So it's a win-win situation for all.
Thank you, Dr. Abhay, for your kind gesture and your presence today. I'm sure your insights would help most of our audience hearing us. We look forward to having so many such conversations in future. Thank you, Doc.
Thank you, Nimisha, and thank you, PhD.